This is a recording of a lecture I gave at the 2025 European College of Veterinary Surgeons Annual Congress. It's about studying focus and memory. Although it's pitched at veterinary specialists, the concepts should be useful for anyone looking to digest or deliver complex information. Have you ever found yourself really wanting to focus, but your brain has different plans? While you're trying to concentrate, it takes you on a journey to a different time and place that's entirely irrelevant to the task at hand. Perhaps you're reading a paper, but your brain wants you to keep checking your mobile phone. For me, this is familiar territory. I love books, but if the point of reading were to retain knowledge, it would easily be my least efficient activity. Why are we so inefficient? It's because our brains evolved with two tasks in mind: reproduce and don't die. What we see as our misbehaving mind is actually a side effect of a sophisticated self-defense mechanism that doesn't prioritize non-life-saving facts. This system includes a mind-wandering mode which hijacks our consciousness when a task gets boring. If you've ever read several pages of a textbook without registering their content, or missed an exit whilst driving, you have your mind-wandering mode to thank. Our brain's conductor is an attentional switch called the anterior cingulate cortex. It directs resources to whichever mode it thinks we need: scanning for threats, staying on task, or daydreaming. Ideally, your attentional switch should be instructing your brain to stay on task right now and focus on this screen. Well, let's see if it is. I'm going to show you 15 random images in 15 seconds, and you're going to memorize them. Okay, now for the easy bit, letting your minds wander. I'd like you to close your eyes and picture yourselves standing outside your home. To your absolute surprise, there's a bathtub blocking your front door. It's a freestanding tub with ornate gold claw feet. And in it, your closest friend. He or she is shivering uncontrollably, lips blue, teeth chattering. As you rush to help them, you can see why they're so cold. The tub is filled to the brim with iced water. You can practically hear the ice cubes clinking. Empty ice bags are strewn all over the driveway. You quickly help your friend out, wrap them in your coat, and open the front door. But once again, your path is blocked, this time by a precarious pile of textbooks stacked from floor to ceiling. You give them a firm push and they topple with a mighty splash into your hallway. The floor is utterly flooded. It's like a moat. You need to reach the bathroom where you can see water actively pouring out from under the door. To keep your feet dry, you cleverly line up the books end to end, creating a stepping stone path across the moat. As you place the very last book, you spot a shiny silver whistle glinting on top. It's one of those old-fashioned sports coach whistles. You grab it and blow, trying to get the attention of whoever is behind that locked bathroom door, a piercing shriek echoing through your home. The door swings open, and there, sitting on the toilet, is a child, perhaps your own child or maybe a niece or nephew. They're dressed in a surgical gown and gloves, completely engrossed in the board game Operation. That's the game where you use tweezers to remove a plastic bone or kidney without touching the sides and setting off the buzzer. The kid has a massive tantrum because your loud whistle distracted them and they lost the game. Just at that moment you hear a roar, a deep guttural sound. You spin towards your kitchen and see a favourite cat-loving clinician. For me, that's my good friend Nina Keeves. She's engaged in a playful wrestling match with a full-grown Bengal tiger. They both seem to be having the time of their lives, so you chuckle and leave them to it. You move into your living room and find an exercise bike, but this is no ordinary bike. It's clearly a French person's bike, complete with a big blue beret perched on the handlebars and a string of onions draped in the basket. You impulsively put the beret on your head, the onions round your neck, and climb onto the bike, pedalling yourself into a serious sweat. Just as you're starting to tire, you're cheered on by none other than Cristiano Ronaldo. He's dressed in his Portugal football strip, the number 7 on his back. He stops cheering to read something on a crumpled scrap of paper, scratching his head, looking utterly confused. You grab the paper, which is scrawled with complex equations describing how to kick a ball. You scrunch up the note and tell him to just kick it. So he does. He scores a magnificent goal into the top corner of your bookcase and strikes his trademark pose. So now it's time to go. You gather up your friend, who is now dressed and warm, climb into your car and drive off. Okay, you can open your eyes and relax while I tell you two very different real stories. Story number 1. This is a photograph of my friend Henry. We'll go back in time 35 years when Henry was a widely travelled young RAF officer. One evening he found himself in a bar in Phuket, Thailand, one of those dark, intimate basement bars. He was sitting alone, dressed in his RAF uniform, when a stunningly beautiful young lady approached, offering to buy him a drink. This wasn't entirely unusual. Henry was a handsome young man in a handsome uniform. He accepted the offer, and that's the last thing he remembered, until he woke up in a bathtub full of freezing cold water in a room he didn't recognise. Next to the bath, Henry found an old Nokia flip phone with a post-it note stuck to it saying, "Phone this number right now." Henry dialed, reached emergency services and described his situation. They asked if he was injured. "No," he replied, "but my lower back is very painful." The operator told him to reach around to see if he could feel stitches or a tube, and he could. "Don't panic," the operator told Henry, "but you've been drugged and one of your kidneys has been stolen. There should be an address nearby. Find it and read it out." Henry found the address on the back of the post-it, read it to the operator, who sent an ambulance. Story number 2. In the 2023 paper by Nagahiro et al., published in the American Journal of Veterinary Research, they state, I quote, "Younger dogs tended to have a lower quadriceps muscle length to femoral length ratio and high anatomical lateral distal femoral angles. Numerous dogs less than 10 months of age had an extremely low QML to FL ratio of less than 0.8 and extremely high ALDFA of more than 100 degrees. Okay. Question 1. What brand of mobile phone did Henry use to call emergency services? Was it a Motorola, a Nokia, an Ericsson, or a Samsung? Easy, right? It was a Nokia, specifically an old Nokia flip phone. Question 2. Based on Nagahiro et al.'s 2023 paper, which statement about younger dogs is correct? Did they have lower quadriceps muscle length to femoral length ratios and high anatomical lateral distal femoral angles? Higher quadriceps muscle length to femoral length ratios and high anatomical lateral distal femoral angles? Higher quadriceps muscle length to femoral length ratios and low anatomical lateral distal femoral angles? Or did they have lower quadriceps muscle length to femoral length ratios and low anatomical lateral distal femoral angles? Now here's the real question. What makes the details about what happened to Henry so memorable? I have no practical use for the phone's manufacturer, yet it's firmly etched in my mind. I have no use for the lyrics of the song Copacabana, yet I vividly recall that the singer wants to know if I like pina coladas. While this useless information sticks, potentially valuable data like the specifics of textbooks and scientific papers is almost always frustratingly slippery. Why is that? And more importantly, how can we remember genuinely useful data with the same clarity as song lyrics and frozen friends who've just lost a kidney? Put simply, the absurd sticks while dry scientific facts go in one ear and out the other, which presents a problem because this lecture should involve a comprehensive literature review, in other words, 30 minutes of dry scientific facts. Well, I could sit here and regurgitate this paper, which you could just as easily read without my help. If I did, you'd likely remember about 5% of this lecture in 2 weeks. What a waste of everyone's time. So we are not going to do that. I'll do my best instead to give you a fighting chance of remembering most of this lecture by focusing on how to learn rather than what to learn. So how much do we really need to remember? Well, in this study, patients were asked if it created a negative impression when their doctor looked something up, and the answer was yes. Patients preferred doctors to know everything without needing to check. Younger patients in particular felt they could perform an equally effective online search themselves and were especially skeptical of doctors who were not from their native country. Put simply, medical professionals are expected to have instant recall. Now consider the volume of information we're expected to remember. A 2003 study calculated that keeping up with the relevant literature would require general practitioners to read for over 20 hours per day, and that was 22 years ago. Since then, the scientific literature has increased at least six-fold. There are literally not enough hours in the day to even read, let alone learn all the relevant literature. Well, that's human healthcare, but what about veterinary specialists like us? Well, the ECVS reading list approximates 21,000 pages. If you laid those pages end to end, they would span about 6 kilometers. To read it, working 1 hour a day, 6 days per week, at a reading speed of 150 words per minute, would take you 3.5 years, conveniently the duration of a surgery residency. But we're not just expected to read it. We must memorize specific facts and recall them months later in an exam or years later when we're working with our patients. Now factor in the time spent learning to interpret that published data, the hundreds of hours in journal clubs, imaging rounds, pathology labs, and medical rotations. Is it any surprise that we're so proud and protective of our hard-earned title of specialist? 2003 study, 20 hours per day, 21,000 pages. That's a lot of numbers. But when someone asks you about this lecture, there's only one statistic you need, so I'll help you remember it. If you laid those pages end to end, they would span about 6 kilometers, or the length of 55 soccer pitches. How do you remember the number 6? Well, this is a core idea behind the PEG system, a simple yet powerful mnemonic. If 6 is a whistle, then 1 could be a paintbrush, 2 would be a swan, 3 a cloverleaf, 4 a sailboat, and 5 a starfish. This system works by replacing single numbers with vivid objects that physically resemble their shape. To use it, you link the information you want to remember to the corresponding image, but to make it truly stick, these images need to be concrete and ideally animate. 5 isn't just a starfish, it's a living creature wriggling around on your hand. You can feel its rough texture, see its vibrant colours, and even smell the sea on it. We must deeply process each image and give it as much attention as possible, because the more sensory detail we add, the stronger the memory. You've just learnt that the public expect medical professionals to memorise an impossibly large volume of data. What else do people expect? Well, this 2023 study identified the qualities that define a great surgeon from the viewpoints of patients, healthcare workers, and surgeons themselves. The most frequently cited quality across all respondents was dexterity. So in principle, surgeons should be significantly more dexterous than non-surgeons, but in this case the theory does not translate to practice. For example, this study found that although students pursuing surgical careers perceive themselves as having superior dexterity, objective dexterity testing showed they are no better than students pursuing medical careers. Alarmingly, medicine interns outperformed aspiring surgeons in 3 of 4 laparoscopic simulator tasks. Now, my colleagues and I tested dexterity in surgeons and non-surgeons using a validated pegboard test. The result? Although surgeons were on average more dexterous, differences were small and neither statistically nor clinically significant. What sets us apart isn't our nimble fingers, it's what we're telling them to do, and we can only do the things we remember. An expert is nothing more than someone who uses their memory to see the world differently. And this might explain why surgeons themselves rate knowledge rather than dexterity as the most important determinant of a great surgeon. But the benefit of an excellent memory doesn't begin in the operating room. First, we must decide if our patient needs surgery at all. So picture this, you're a vascular surgeon enrolled in a decision-making study. You've just witnessed an image of a bursting balloon. Well, this couldn't possibly influence a subsequent clinical decision. Or could it? In this study it did. Exposed surgeons' decision-making was significantly affected, and this bias held true even after controlling for their risk attitudes and personal experience. Could veterinary specialists be similarly affected? Well, to find out, I teamed up with my cat-loving friend and part-time tiger wrestler Nina Keeves. We designed a study to test the impact of a recent negative experience, our bursting balloon scenario, on veterinary decision-making. So picture this, your 8:30 appointment is a cat recovering from surgery for a spontaneous cranial cruciate ligament rupture. Sadly, the outcome was poor. This cat suffered a major complication. The owner, who happens to be a medical doctor, claims she wasn't told that the outcome of non-surgical management was often good. She cites this paper and wishes she hadn't consented to surgery. You bear the brunt of her frustration. Then later the same day, you diagnose a spontaneous CCL rupture in your own cat. Would you or wouldn't you operate? Surgeons witnessed the anxiety-inducing scenario either before or after they made a decision about their own cat. And they behaved just like the vascular surgeons. Specialists exposed to the negative event first were significantly less likely to operate on their own cat. This effect, termed availability bias, powerfully illustrates the role of a vivid, and in this case negative, memory on important clinical decisions. So where are we now? Well, the public expects us to have superhuman recall, but we don't. We believe we have superhuman dexterity, but we don't. And we also believe that we make genuinely objective decisions, but we don't. We've learnt the PEG system to remember a sequence of single numbers, but what about longer numbers like dates and telephone numbers? Here's where we up the mnemonic stakes with the major system. It converts numbers into letters which we combine to create words. We can then string those words together to create vivid images and stories. The principle of converting forgettable numbers into memorable images, termed elaborative encoding, is the bedrock of mnemonics. Here's the code. Vowels and the letters W, H and Y act as fillers. We only have half an hour, not enough time to explain why the major system assigns certain letters to numbers, but there is a clever explanation, and if you're unfamiliar, I highly encourage you to look it up. Let's apply the major system to a paper we met earlier. We're outside our local Aldi supermarket, witnessing an argument between Thor and his very angry wife, who happens to be a gnome. She's nagging him for carrying fewer bags than her. The lead author is Nag a Hero. Mrs. Gnome, with her silent G, contains the letters N, the number 2 in the major system, and M, the number 3, reminding us that this paper was published in 2023 in the American Journal of Veterinary Research. The first supermarket aisle is blocked by dozens of cute, bow-legged Yorkshire Terrier puppies. You pick one up and find it has quadriceps contracture. In fact, all the puppies have quadriceps contracture, so you can easily remember that the puppies in this study had relatively low quadriceps muscle to femoral length ratios. But when you check the Aldi price tags, the puppies are more expensive than adult Yorkshire Terriers. Well, of course, people will always pay more for cute puppies. And this helps you remember that puppies' anatomical lateral distal femoral angle, ALDA, close enough to Aldi, was relatively high. Time for another story. On the 5th of September 2015, I woke at 3 a.m. in a hotel room in Bagnères-de-Luchon in the French Pyrenees. I got dressed, I had breakfast and climbed onto my bicycle. My target, which I hoped to reach before sunset, was Biarritz on the west coast, a distance of 330 kilometres with 6,300 metres of climbing. Now there was no warm-up, straight up a 15-kilometre mountain, followed by another 12-kilometre climb. Then the Col de Tourmalet, the beast of the Pyrenees, a 23-kilometre monster with an average gradient of over 7%. I stopped for breakfast here before tackling the final ascent, a combined 1,300-metre climb of 2 enormous cols. I'd pre-planned lunch in a village called Oloron, but alas, all the restaurants were closed because it was 11:15 on a Sunday in France. Luckily, a friendly local made me a sandwich so I could hit the road for the second half, which was flat but grueling because I was so hungry. I reached my destination at 7 p.m, 15.5 hours after setting off. What would happen if I attempted this ride now, a decade later? Well, I'll tell you what would happen. I'd get halfway up the first mountain, climb off, eat all my food and head straight back to the hotel for a coffee and a croissant. But 10 years ago, I was obsessed with riding my bicycle. That year I rode 11,300 kilometres. This is how most people see studying efficiency, by focusing on training volume rather than intensity. How many hours did you put in? But if you want to be a good amateur athlete and you have limited time, you need high intensity interval training. I just spent all that time on a story about a bike ride for good reason. It's a crucial analogy. Visualization techniques like memory palaces and the major system are the high intensity intervals of studying. They're incredibly efficient precisely because they're so hard. Just as we can't do high intensity intervals for all our physical training, we must reserve these mnemonics for specific important tasks. As for our high volume, low intensity training, the published literature suggests most of this should involve self-testing. If you remember nothing else from this lecture, please remember this. Remember Cristiano Ronaldo? He's a magical number 7, but not the magical number 7. The true magical number 7 is the average number of facts we can retain at any one time. But recent studies suggest that Miller's classic 7 plus or minus 2 estimate is overly optimistic, with the true capacity of working memory being closer to 4. Why is this relevant to a lecture on studying techniques for surgeons? Because the success of your operations depends not just on your skill, but also on caregivers accurately following your instructions. These instructions are effectively new, critical information caregivers must process and remember. Here's one of my discharge instructions written over a decade ago when I wrongly believed that writing in bold font and capital letters made a difference. Let's count some new facts. Please read this form carefully. What is TPLO? Healing takes a minimum of 6 weeks. Each walk should be up to 10 minutes, 3 to 4 times daily for the first 3 weeks, then 15 to 20 minutes, 3 to 4 times daily for weeks 4 to 6. Avoid trotting, no running or jumping, avoid slippery surfaces and stairs. Always use the e-collar. That's 15 new facts, and I've not even covered expected function, medications, red flags, and the recheck schedule. A typical discharge instruction contains at least 50 new pieces of information, 12 times the amount that an average person can reliably hold in their short-term memory. So what, you might argue? They can refer to the written instructions, that's why I wrote them, which would be fine if people actually read them. But multiple studies show that many caregivers don't. This study, published in Pediatric Emergency Care, found that only 9% of parents read their child's emergency department discharge instructions, just 9%. For the past 4 years I've used video discharge instructions. Not only are they proven to improve comprehension and reduce risk, but they allow me to quantify engagement. When I first started using them, less than half watched to the end, but when caregivers were told I knew how much they'd watched, engagement jumped to over 100%, probably because they recognised how useful they were and shared them with family members. So most parents don't read written instructions, and most can't retain more than 4 dry facts from our verbal instructions. How do we fix this problem? Well, we harness the feature of our memory which is efficient. As terrible as we are at memorizing lists of words or numbers, we excel at visual imagery. Here are the 15 images I showed you earlier, now paired with new images called distractors. This is a standard 2-picture recognition test. Count off your correct answers and we'll see how you do. If you got 13 or more, congratulations, you're completely normal. This study found ordinary people remembered around 90% of 2,500 images shown over 5.5 hours. Our brains have a massive storage capacity for visual details. How do I harness this in my clinics? By sharing the most important messages using vivid visual imagery. Here's an animation I often use to reinforce the crucial point that a dog mustn't do too much exercise too soon after an operation. While I'm describing appropriate exercise levels, this animation plays on loop. By the time I move on to the next slide, which shows the proportion of dogs who suffer a complication, i.e. what we're trying to avoid with exercise restriction, they've watched that loop over 20 times. And when I ask what they remembered from the original consult 6 weeks later, it's always the squirrel and the exploding TPLO. It's time to leave our memory palace behind and climb into our car with our friend. All good stories need a take-home message. This is mine. The tale I told you about Henry isn't true. The famous kidney heist is a popular myth used in this case to make an important point. We are in the end the sum of our memories. They are the stories we tell, the lessons we've learned, and the connections we've forged. Our greatest gift isn't a possession, but ourselves. And without our memories, we lose our very identity. It's second nature to exercise our bodies to stay healthy. Shouldn't we give our minds the same respect? Next time you find yourself mindlessly scrolling through emails or social media, why not pause and practice your mnemonics instead?